Hello, welcome back to my channel once again. This is Eli Newton 360. According to the World Health Organization, there are over 1 million sexually transmitted infections that are acquired every day, meaning every 1 minute there are 9 infections now. And then recently we saw the data that was released by the Ghana AIDS Commission as well. And so today we are here to speak to a professional at the Ho Polyclinic who knows the ins and outs of STIs and everything related to STIs. So come along. Alright, so just as we promised, we are finally here to have a conversation with Auntie Precious. Good morning, Auntie Precious.
Good morning.
So I know you, but my viewers don't know you. So would you please tell us a bit about yourself?
Okay, I'm Precious Amevo.
Okay.
And known on the streets by a lot of people as Ginja. You hardly find me with Precious.
Ginja.
Yes.
Why are the Ginja people?
It has nothing to do with that. It's Ginja, okay, which is an acronym. It has nothing to do with
the
spices. I'm a general nurse. I work at Ho Polyclinic. And that's basically it. I do a few other things here and there.
Okay. Alright, so just as we initially requested, would like to know more about one very prevalent issue. That is about STIs. This is something a lot of people don't want to talk about, but I want to be able to break that chain. Just as you are a professional, we want to have your take on that.
STIs are a group of infections that is kind of like acquired mostly through sex, with influence on mostly, because there are a few other ones that can be acquired through other means, but then mostly through sex. Hence the name sexual transmitted infection or sexual transmitted diseases. Yes. For the common ones, most people will want to talk about the gonorrhea and then the syphilis, HIV. People don't even consider HIV as an STI any longer. They see HIV to be solely on its own, but no. HIV is one of the STIs. There are many, the chlamydias, that people don't want to talk about because they only know gonorrhea and then syphilis. But there's quite a broad spectrum of those STIs.
Right. How does one contract an STI?
We've already said STIs are transmitted mostly through sex. And I was stressing on the mostly.
Okay. So
we have through unprotected penetrative sex. It could be vaginal sex, oral sex, anal sex, any form of penetrative sex. Then we have the mother-to-child transmission. Mother-to-child transmission of STIs, which could be through delivery, during delivery, whilst delivery is being conducted, then sometimes through breastfeeding, and sometimes even in utero. Some of them, through delivery ones, we have the HIVs, the gonorrheas that you can pick from a mother can give to a child. So the child did not go to have sex. You know, the child did not go to have sex, but then ended up with STIs. Yes. Then during pregnancy, we still have HIV and syphilis. So whilst you're pregnant and you have syphilis, you can transmit it onto your child. Then we have a true breastfeeding, HIV. So an HIV positive mother who is not on treatment can intend give HIV to a newborn through breastfeeding. Then we have blood and blood products. That's for the general population. Mostly for the men, the barbering shop. It's one of the main danger sites. Barbering shop. Of late, most of the sterilizers out there are not correct. They're just seeing blue lights. There's no anything. Some of them don't even show the lights. Yeah. So we are advising everyone just get their own barbering machine.
Which is very difficult.
No, but actually, if you're following those STI data, recently they released the HIV rates, and Charlie, if you look at the infection rate,
even in Ghana,
I think 314,000, some huge figures being quoted, and that is just the ones we have known.
At the facilities.
There are people out there who are living with HIV and they do not know any of this thing. Blood and blood products, blood transfusion in the hospital. That is why before you donate blood, they check and screen you for STIs, HIV inclusive, syphilis. Once they see it in your blood, they are not giving your blood to anybody. No one is. Few times we've had emergencies at the hospital where, see, this blood, we need it. But then there is syphilis in the blood.
So it's wasted.
But that is the only blood available and we need it. So the blood could save your life. No, you could explain to the patient that, see, we have blood that can save your life. But then it is infected with syphilis. You can't treat syphilis.
Wow.
So this things once a while they happen, but it's about good communication and discussion.
Okay.
But blood and blood products, you can get HIV. Sharing sharp needles, razor blades. So you see infected children and you don't know how. They pick blades, sharp stuff anywhere and they use it.
They're infected.
Yeah. So that's basically STI and how you get them transmitted.
Alright, so let's take gonorrhea and maybe chlamydia. If I have any of these, what are the signs that my body will get for me to know that I have?
The symptoms mostly are grouped into, let's say, syndromes.
Okay.
Yes, we group them. So we can talk about the vaginal discharge syndrome, which is to say, I won't tell you that vaginal discharge is because you have gonorrhea. Vaginal discharge syndrome, you can be having vaginal discharge and you could have gonorrhea, you can have chlamydia, you can have even candida. So with STI, there's vaginal discharge, there is urethral discharge for the men, penile discharge still for the men. We have inflamed groin, the in between your legs, those spaces there. Your lymph nodes there gets inflamed. There is painful maturation, simply painful urination.
That's what I wanted to ask.
So I know. There's painful urination for the men. Sometimes there is pain within the penis. There is itching. There is redness. There is ulcer and sores.
Ulcer?
Yes, sores. Ulcer is basically sores.
Oh, okay.
You crow. That's what ulcer is.
All right. Okay.
I'm not referring to peptic ulcer. Peptic
Oh.
ulcer, it is actually a sore in the GI. So anything ulcer, gastrointestinal tract.
Oh, okay.
So anywhere you see ulcer, there is a sore somewhere.
All right. Okay.
So there are sores on the penis, on the perineum, on the vulva. Some of them, there are even sores in the mouth, depending on the kind of STI you have. Some people bleed, still depending on the kind of STI you have. So it's not only discharge from your penis now and say you get STI. No. There are certain rashes even appearing on your body that is indicative of syphilis.
Wow.
Wow. So there are nodules like growth underneath your skin. So sometimes when you start seeing some rashes on your skin and it's persistent, please don't go and buy a boniki. Get screened for STI or visit a health facility and then let them see to you. There are bleedings in some people depending on what it is. For the infants, as in the babies, some of them end up having pneumonia. They were discharged in the eyes, mostly conjunctivitis neonatorium. The names are quite big. That is it. There is pelvic pain. There is lower abdominal pain. So the signs and symptoms are quite many. So it's just a matter of paying attention to your body. And then noticing when there are changes. So that's basically it.
Right. So taking me as a guy, and I have a sister, which of us are most likely to have an STI, or which of us are more vulnerable to STIs?
With STI, we do have this thing we call, let's say, the Iceberg Theory. Okay? Right. There's this whole ice thing where on the tip, you have a smaller tip showing, and there is a bigger block underneath the sea. With a smaller tip on top that everybody sees, they would say that the men are more. That's the ones they see. They are the ones that show symptoms. Symptomatic people with STIs, the men are more, and then the women are few.
Okay.
But then when you look at the bigger block that is not seen by people, those are the asymptomatic ones. Typical STI, people living with STI but not showing symptoms. Those people, it's mostly comprised of women. So in general totality, we would say women are actually more vulnerable to STI, but men indulge in more risky behaviors.
Okay.
So the kind of like vulnerability depends on the angle you are looking at it from. Women, because of their natural composition and how they are even created, the location of their vulva and their sex organs, they are prone to something similar in the pig. But men is mainly because of their sexual behaviors and stuff like that.
I see. So are all STIs treatable?
Treatable, yes, all STIs are treatable,
okay,
but then some are not curable. We can treat and manage, you will be stable, but then you remain a carrier for the rest of your life.
Wow.
Mostly the viral ones. STIs are caused by a variety of germs. We have the fungi, we have the protozoas, we have the bacteria, we have the viruses, and we have the ectoparasites. You understand? So the viral ones, once you pick a viral infection, a viral STI, it's with you. The HIVs don't leave. The herpes simplex, they don't leave. The genital warts, they stay. So you become a carrier. So you are treated, you are fine. You are no longer showing symptoms, but you remain a carrier for life. When exposed to those germs again, you can quickly relapse an infection or infect other people.
Wow.
So that's basically.
It's a bit scary.
Yeah,
so apart from HIV, what other ones fall in the same category? Like the ones that you can actually treat and then manage, but you still have it with you.
Let's say herpes. Herpes simplex. Yes. The herpes simplex caused by the HSVs. We have the genital warts, which is also caused by the human papillomavirus.
Wow.
Most of the viral infections, they don't live.
Okay.
Yes.
So is hepatitis B transmitted through sex?
Yes. Hepatitis B can be transmitted through sex. Sex is not the only means to transmit hepatitis B. Sex is just one of the ways through which you can be infected with hepatitis B.
Okay.
Yes.
So sex is something that most people or most of us cannot stay away from. And the issue of STI is also very alarming every day. Even according to the WHO, every day there are an estimation of about 1 million STIs that are
new infections.
Yes, every day. So how do we actually protect ourselves from these STIs?
Basically, I think hepatitis B is the only STI that has a virus, a vaccine out now.
Okay.
So you can just get vaccinated so that you don't pick it up. But all the others do not have any medicinal prevention. One main preventive measure we are advising people on now is the use of condoms. Like, anyhow, the use of condoms. People used to complain condoms are thick, they are this, they are this. But believe you me, now there are very thin layered condoms on the market that typically feel like skin.
Okay.
So we are encouraging more people to use the condoms. And then mutual faithfulness. I am saying mutual faithfulness because if you're in a relationship and it's only one partner that is faithful, you are faithful, your other partner is not. He or she will bring it to you from out there. So it is mutual faithfulness.
So if I suspect I have an STI, before that, there are certain drugs on the market and people do self-medication. I have personally heard people say that when you have something like gonorrhea, you can treat gonorrhea with amoxicillin, so they don't go to the health facilities. Is that good? So if we have, what should we do if you suspect your body?
We all know over-the-counter medications without prescription, self-medicating, they are all not right. For, as I said, you may be having a penile discharge and you would think it is gonorrhea. You would go for medical checkup and you will be told this is not gonorrhea, this is chlamydia. This is not gonorrhea, this is probably syphilis.
So there are different treatments for...
Oh yeah, obviously. As I said, they are caused by various germs.
Okay.
The medications you'll be using to treat a bacterial infection would differ from the medications you would use to treat a viral infection. If you have syphilis, it is a viral infection, and you are busy pumping antibiotics into your system. Cause 90. And sometimes we go beyond treating you. We do partner treatment.
What is partner treatment?
If you have STI, maybe it's a female has STI. It's sexually transmitted. You are having sex with someone. It is assumed the person has already been infected.
Okay.
So we try to get the two of you to treat. Because if we are treating one person and then the other person is not receiving treatment, he or she would come back and then infect you. So we try to treat couple. We want to treat the two of you to be sure treatment is effective. And even whilst we are treating STI, we advise you refrain from sexual activities until you are fine.
I see. And so do people actually follow that?
They're refraining from...
Yes. When they are on treatment.
I believe the ability for clients to adhere to some of those things has to do with how adequate your counseling is.
Okay.
If I'm able to tell you why you should not do A, B, C, and what happens if you do them, I believe you would consciously make an effort to listen.
Okay.
Few times you don't get 100% adherence, but most people who are concerned, because as STIs they will worry you. And believe you me, you would never go to the hospital for treatment for malaria, but you would really want to treat STIs.
Yeah, sure.
Because they are uncomfortable and they are visible. When you start having ulcers all over your penis and you want to go talk to a girl, come on, you wouldn't want to, so you would seek treatment.
Okay. And I also heard something, I don't know if it's a misconception, but someone said when you have gonorrhea and you masturbate, you'll be okay. Is that true? Have you ever come across that?
No, as the misconceptions, there are many. People think gonorrhea has to do with just a penile discharge. So they assume once you are masturbating and then you finish discharging all what is in there, then you will fine. But you see, you will discharge all what has been produced. It will come out. A new set of process will start. When you want to follow the pathophysiology of this STI, it's how they enter your body and what they go with you before they finally settle and show symptoms. You will realize you cannot just masturbate a gonorrhea bacteria out of your system. All you need is medications. Yes, for a number of days. People are quick to just take it today and they say they are fine. Their bacteria, like gonorrhea like this, we have the Neisseria gonorrhea causing it. Charlie, you need to put yourself on treatment. It's very necessary. So you can't masturbate gonorrhea out of your system at all.
So what are some of the things we need to do and not to do, either when we suspect our body or we are on treatment?
The very minute you realize you know or you suspect you have STI, stay away from sex.
Number one, stay away from sex.
It's very necessary because you would infect other people and you will pick other infections. Now, in the face of HIV, if you are probably infected with type 1, because we have type 1 and we have type 2. If you're probably infected with type 1 HIV and you think you want to give it out or you don't care and you're sleeping around, you may end up adding a type 2. So that is it. So stay away from sex. Put yourself on treatment. Complete the treatment regimen. then you can go back to having sex.
Okay.
If you cannot stay away from sex, condoms.
Those of you who cannot stay away from sex, like someone I know, I will not mention any names.
It's necessary. Condoms. Yes. It's very, very, very necessary. Condoms. But that's basically it. And then don't self-medicate. Herbal concoctions.
Yeah.
Herbal medications. If you want to go herbal, now there are herbal centers in some hospitals. Go there, be seen, and be given correct dosages of medications instead of buying those over-counter herbal preparations. That's it.
All right. So, but can you do first aid when it comes to STIs?
Which one are you first aiding for? You are having a penile discharge.
Yeah.
How are you able to tell which one exactly you have?
So the best is just to go
seek medical care.
Okay.
Now we've even gone to this era where we are doing syndromic approach to treatment. Syndromic approach basically means that we are treating you based on symptoms you are presenting.
Okay.
Instead of typically insisting you do labs. So when you come to me in my unit with vaginal discharge or penile discharge or urethral discharge, so I'll treat you for vaginal discharge syndrome. So the question is, what conditions or what STIs can make you have vaginal discharge or penile discharge? So we are looking at candidiasis, we are looking at gonorrhea, we are looking at chlamydia. Do you understand?
Yes.
So I would give you treatment which can tackle all those conditions.
I get it.
At a go.
Yes.
Sometimes you come with ulcers, then I'm looking at, okay, let's treat chancroid, let's treat syphilis, let's treat herpes. You come with growths, and I'm like, quickly with growths, instantly, I'm like, okay, we are looking at what? Genital ones. We advise you seek medical care. Seek medical care. Presently, I'm working on some few campaigns here and there where I've actually been trained to manage STIs.
Okay.
Trained and certified. Yes, by National AIDS Commission programs. Yes.
Wow.
So I have flyers out there with my contacts on it. You can just contact me. For people are uncomfortable going to the mainstream hospital to say, I have HIV or I have gonorrhea. It's uncomfortable. So we advise, if you cannot go, there are a few people out there rendering this kind of services. Talk to someone.
Okay.
And get treated.
All right. So we can put your contact details out there, right?
Yeah.
Maybe you give us one of your flyers for us to.
Okay. Yeah, I have quite a lot of flyers. So
okay.
I'll share them with you so
right.
that you can share with your viewers.
All right. So, kindly give us your final words before we take our leave.
The STI rate in the country is increasing. I am seeing this factually with facts and with data. It is increasing day in, day out. And now, STI, there's no look to it. You cannot see someone and say, you look like you have STI. Gone were the days where you could just see someone and say, HIV, this person did. The person has HIV. Even now, trust me, they don't look, there is no look like HIV look. They even look healthier. So still stick. If you're going to ask for the ABC abstinence, Charlie, we cannot. Being faithful, there are a few people working on that. Condom use, we are advising it, and then medication. If you are not able to do any of the above three and then you get infected, treat yourself ASAP. There are lasting complications of STIs. One is infertility for both genders, male or female. If you have STIs, you do not treat. You can become sterile. You cannot produce babies any longer.
Wow.
There are other serious ones. People with genital warts, you can have extensive growth covering your entire perineal area, either the vulva or your perineum. Those who have anal warts, and also we are advising everybody seek early treatment. Early treatment is very, very necessary. There are stages to STI, stage 1, stage 2, latent stages and phases. So the very minute you suspect, seek medical care ASAP. And you may curb the later dangers associated.
Right. So the very moment you suspect you have any STI, seek medical attention. Sister Precious, thank you for having us.
Welcome.
And I hope this will go a long way to educate us, because yes, as you said, the data out there is so alarming.
Yeah.
Yes, so thank you. And whenever we need something else from you, we'll call on you once again.
No, it's my pleasure.
Thank you. All right.
Thank you.
Akpena oha.